I've been working here for 10 years and I work with children all the way through to pensioners. It's a combination of counselling and letting people express themselves through art. So even when words are hard to find, the art can contain it and they can get out all those emotions into the clay or onto the page. I think they have all the answers within themselves. It's just finding a way to let that come to the surface.
I was directed to Cancer Focus by my breast care team up at the Ulster Independent. They handed me a whole pile of leaflets when I got my diagnosis and really were very enthusiastic about coming to Cancer Focus, particularly for underwear and things like that. And then they talked about the different counselling services that were available, and once I sort of came down and had a nosy through everything, sort of got a better idea of what was available. Rachel Smith came out to speak to us, and it was her that first suggested the art therapy. I find it quite hard to talk about me. I'm sure the art therapist Joanne would attest to that. I talk about my husband, my kids, my mother, my work. I talk about everything except me. So I find the art's a really good way to sort of deal with myself without having to necessarily discuss it, if that makes sense. And it gives me a space to talk about everything else as well. But because the art therapy is all mine, just to myself, I find that it really helps me as well.